says they want to come up first.
Have to cross a mile away and older people walking.
Does it bother you if I don't have a mask
Get
on?
upset. And I said, excuse me.
I, and state your name,
I, Lisa Ellis,
having been elected to the office
having been elected to the office
of County Board District 1
of County Board District 1
in and for the County of Edgar, the state of Illinois,
in the County of Edgar and State of Illinois,
do solemnly swear or affirm
do solemnly swear or affirm
that I will support the Constitution of the United States
that I will support the Constitution of the United States
and the Constitution of the state of Illinois,
and the Constitution of the State of Illinois,
and that I will faithfully discharge the duties
and that I will faithfully discharge the duties
of office of County Board
County Board
to the best of my ability.
to the best of my ability.
Jensen.
We clapped because you remembered everything you said.
You did good.
I'm like, what?
I do have to do what?
This ought to be good.
I, and state your name,
I, Jeff Foy,
having been elected
having been elected
to the office of County Board District 2
to the office of County Board District 2
in and for the County of Edgar
in and for the County of Edgar
and state of Illinois,
and State of Illinois,
do solemnly swear or affirm
do solemnly swear or affirm
that I will support the Constitution of the United States
that I will support the Constitution of the United States
and the Constitution of the state of Illinois,
and the Constitution of the State of Illinois,
and that I will faithfully discharge the duties of the office
and that I will faithfully discharge the duties of the office
of County Board
of County Board
to the best of my ability.
to the best of my abilities.
You did good.
Should this be me here?
You like that. Someone's running from
Thank
us.
you, Steve.
This is a challenge here.
So you want me to do the whole thing?
All at once.
I get that at home, you know.
In the cheat sheet.
I, and state your name,
I, Phil Levington,
having been elected to the office
having been elected to the office
of County Board District 6
of County Board District 6
in and for the County of Edgar
in and for the County of Edgar
and state of Illinois,
and the state of Illinois,
do solemnly swear or affirm
do solemnly swear or affirm
that I will support the Constitution of the United States
that I will support the Constitution of the United States
and the Constitution of the state of Illinois,
and the Constitution of the state of Illinois,
and that I will faithfully discharge the duties
and that I will faithfully discharge the duties
of the office of County Board
of the office of County Board
to the best of my ability.
to the best of my ability. See, I knew I could do it as long as you made it easy.
And have any faith in you.
I don't really like it. Thank you. Yeah, you were all hoping, weren't you?
Yes, you will. This one.
Russ Lawton,
having been elected to the office
having been elected to the office
of County Board District 7
of County Board District 7
in and for the County of Edgar
in and for the County of Edgar
and State of Illinois,
and State of Illinois.
do solemnly swear or affirm
Do solemnly swear or affirm
that I will support the Constitution of the United States
that I will support the Constitution of the United States
and the Constitution of the State of Illinois,
and the Constitution of the State of Illinois,
and that I will faithfully discharge the duties
and I will faithfully discharge the duties
of the office of County Board
of the office of County Board
to the best of my ability.
to the best of my abilities.
Congratulations.
You gonna have any big Christmas parties coming up?
They're all canceled. None of them Christmas. Everything canceled.
Why?
COVID.
How about Main Street
They're closed.
No.
They're open.
They're open.
I hope everybody's.
Main Street.
You tell the truth.
This man better here, but it's been costing more. I didn't see for us, but
That's all right.
times are different right now.
I'd like to call the organizational meeting to order. Would you please rise and say the Pledge of Allegiance? I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
So today is December 7th. We've had our swearing in of elected officials. And so now I would entertain nomination for chairman. Okay,
Jeff Ford.
for Jeff Boyd. All right.
I second.
Okay. Any other nominations? All right, all those in favor of Jeff Voigt for chairman of the board signify by aye.
Aye.
Opposed? Motion carried.
Thank you, Augie. Thanks, Walsh.
Did they gonna get that done? That was close. He's the only guy done enough to do the job.
That's for sure. Well, that's me.
He's gonna tell you all about it.
Next order of business is to elect a vice chairman. Nominations are now open. Phil,
Carl,
is there a second?
I second.
Dan seconds. Are there further nominations? Hearing none, I assume you're ready to vote. All those in favor of Carl Farnham as vice chairman of the Edgar County Board, please signify by saying aye.
Aye.
Opposed, nay? Congratulations, Carl. You're it.
has anybody ever recommended somebody and then voted nay? I mean, just for general principle? No? Oh, crap, that's not fun.
Okay, we've got to wait for 9:30 to roll around, so we're this part of, oh, I'm sorry.
9:15.
Excuse me 1 second. We need to have public comment. Is there any public comment this morning for this particular portion of our meeting? Hearing none. Motion to adjourn. Andy moves. Carl seconds. All those in favor signify by saying aye.
Aye.
Opposed, nay. We are adjourned until 9:30 when the study session starts. Fine.
All right, excuse me. Mr. Chairman, we're ready.
Okay, we're going to call the study session to order. We've already said the pledge, so we're going to go directly to, let's see, hang on here. Public comment. Is there any public comment before we start our study session this morning? Hearing none, we'll go to Road and Bridge and MFT. You got it.
Okay, Wednesday's meeting is going to be two resolutions, pretty much both housekeeping. The first one's going to be our GM appropriation, our general maintenance appropriation for next year. And the second one's, we had 10-year-old intergovernmental agreements with the townships. And 10 years ago, we're gonna kind of follow the same protocol. I'll read it, it's a little awkward, where you guys authorized me to enter into an agreement, the county chair, or the county engineer. And then we meet with the road commissioners this month for their budgets. It's a pretty extensive effort. And at that meeting, along with a bunch of other things, we'll hand down the intergovernmental agreement that you guys authorized me to sign. It's the exact same intergovernmental agreement as 10 years ago. We're just clarifying some things, the housekeeping for IDOT. So I'm gonna ask, Jeff will ask you to authorize through a resolution my ability to sign an intergovernmental agreement with all 15 townships, and then probably about March, April, when we get them all back, then there'll be an item on your agenda that'll say a motion to file all 15, assuming all 15 townships sign them, which I anticipate they all will. Yes.
So do all 15 township supervisors attend the meetings?
Individually, yeah, they can be like an hour long, they could be 15 minutes long, but it's gonna be pretty extensive this time because there's the TRF money and the bond money, and there's a lot of question marks.
So you're telling them how much of the money that you receive will be going to them?
We gotta be careful how
Or
we
that
word
they
that.
have
Yeah, that
use.
statutorily, we receive it, but our approach is it's their money and we allow them to spend it how they choose to. The county has oversight of their motor fuel tax. But what we do every year is we sit down with them and they have to put a budget together of what they think they're gonna do with their motor fuel tax. And then it has to go over to IDOT for review and approval. So a road commissioner has to go to a county engineer and say, this is what I'd like to do with my motor fuel tax next year.
Per state law.
Per state law, county engineer will look at it and says, that makes sense to me, I'll sign it. Then that county engineer sends it over to the Department of Transportation, who looks at it, says that looks,
And how's it allocated? I mean, how's it appropriated?
it comes monthly to county coffers. We have to approve their expenditures, so road commissioner A has to follow his budget. So we have supervision and oversight in our office.
So is it based on the number of miles?
Yes.
Miles in a
It
township?
is. I'm sorry, I didn't understand the
Miles of
question.
road in a township?
Do we
Yeah.
keep any of that money?
We don't keep, well, we get an administrative fee at the end of the year of 5%, and yes. We don't keep any of it, we get paid to
By the state of
administer motor fuel
Illinois.
tax. We don't keep any of it.
Right. I just want to make that point.
We pay ourselves a couple months, like we'll pay ourselves out of their money, which they approve, which is what this intergovernmental agreement also states, is what the engineering fee is. Usually in the spring of the following year, and it's 5%, we intend to keep that the same. So we have a resolution from a county board from 1971 that says, I don't know what year it is, but that the engineering fee will be 5% for, and we didn't include that in 2010 or so, I can't remember what it was, but intergovernmental agreement, and we're trying to be more and more careful about our housekeeping to make sure that everything, because we had an audit, Springfield came in and did an audit of us and said, why are you charging 5%? And we said, well, here's the resolution. Very common, very cost effective. To give you a perspective, it won't pay, the 5% of all the townships in the past hasn't been enough to pay a staff member to administer, so. More questions? I like questions.
Thank you.
This is kind of a rare occasion, could be a decade before we do this again. Yes, Dan?
I was reading somewhere, I think it's Indiana, that trying to do away with townships. Is that happening in Illinois?
I think there was a pretty significant effort by the Rauner administration to do that, but I think since his departure, Jeff might want to weigh in on this. I don't think there's statutes that provide for it if the county board wants to be aggressive and pursue that, but I don't think it's being pushed any longer.
I missed the first part of it. What
And
am I?
wondered if there's an effort to consolidate townships in Illinois.
Politically, I think the attention is being paid elsewhere right now. Back a few years ago, that was on the burner. I don't think that's on the state's burner right now. And I don't know that we even locally have any desire to do that. I've been able to ascertain from the board, ascertain like that, in the past that we've not been interested in that. Intergovernmental agreements and cooperation with the township seem to be the best way to go at this point, unless something else changes. And the state seems to be doing a better job of making resources available to the townships. And if they were trying to get rid of them, I don't think they would be doing that. That's my opinion.
I would agree with it. We also have IGAs with villages and with some school districts and current IGAs that we would revisit if we were to do something again. So if, for instance, Kansas School or Crestwood School or something would want us to do something again, which they may, then I would come to you guys individually on each of those rather than do a, because statutorily we don't have any responsibility with them, what the townships would do. But the county board in the past, in my tenure, the county board has been very receptive and I even go as far as say eager to help the school districts with their. Any other questions about the two resolutions? The motor fuel tax appropriation for the year and the resolution to authorize me to sign intergovernmental agreements with all 15 townships. Okay, and then I think in the interest of time, I will not go through the rest of this. Try to see if there's anything there that would be of interest. We're in quarantine, I guess that's kind of interest. We have our operations department's in a 14-day quarantine, so we don't have anybody out there right now. Still waiting on our $10,000 from Navistar for the engine settlement, and once we get that, there's a 4-month-old or 3-month-old board-approved lease prospect for that tandem. And do you guys have any other old business or new business that you'd like to discuss?
I just got a question. I noticed we paid Interstar 93 grand.
Yes.
Is that the last one?
No, we have 2 more of those.
Two more,
There's
okay.
loan 1 and loan 2. There was a $400,000 and a $350,000.
Okay,
So that in April, you'll get the payment on loan 2 for that.
okay.
And then there's 2 more of loan 1 and I think 3 more of loan 2. But all that money is coming in the form of Township Bridge Program.
Good.
So we got our Township Bridge Program money in October, November, and now we're making payments with it.
Staffing? Anything to say on staffing?
Staffing could get long-winded, but we have 3, we're down to 2 temps, 2 seasonals that we're looking at for possible full-time employment. Would you want to comment on that, or?
No, I just wondered if you were starting to stabilize. I know that we're going through a rebuilding. Are you
Absolutely.
satisfied with the way that's going, I guess
Yes,
is
it's
the
been
question.
difficult. We're going through a rebuilding. We made a requirement, as you guys know, that everyone gets their Class A's, and we're down to 1 person. We still have 1 more left, which that's good. We have 2 people that we're looking at closely for possible full-time employment. The COVID's knocked one of our seasonals out, and that was a little upsetting to him. We have a couple guys that will probably surface their last season because of age. So we're trying to gear up and be ready. We believe that this could be the largest township program in a couple decades anyway, not ever. Depends on how they budget their money this year. So it's a kind of an inopportune time for us to have a rebuilding project, but we're up for it. Any questions about personnel or?
Okay.
Any other old business or new business? Anybody? Any public comment? Okay, and then I'm not adjourning, I'm just stepping away.
No, you're just stepping away.
Okay,
Or you could say if you want to.
well, I appreciate you fitting me into your agenda.
No.
Thank you.
Your
Did you guys
agenda is
get
our
them, those?
agenda.
Did you want me to, did you get them?
Yeah, too.
Thanks, Aaron.
Thank you guys.
You all good?
Oh,
Yes, sir.
see, that's a check for me. I'm not gonna bring have to use.
Okay, we'll go to the ambulance service. Samuel Adam? No, no. I'm sorry. I'm out of control.
I'll preface that and tell you in just a moment. So yes, it is not colored. So with the hospital transitioning into having an isolation unit, they had me vacate my office because my office is now the nurse's station for the isolation unit. So I am a nomad and get to work out of a backpack. I think it's their way of kicking me out slowly. I don't know, but so no, I lost my color printer. But if you look at November, we had 166 calls, still averaging a little over 5 a day as compared to 130 this time last year. Still maintaining our response times, nothing's drastic or significant there. 39 emergent transfers, 16 non-emergent transfers, 3 fire standbys, 2 deaths, 33 treat no transport. The only column that I added in there that's a little bit new between public assistance and appointment is called mobile integrated health. That is a service line. I spoke to you guys earlier about me transitioning away from the ambulance and starting a new service line, and this is something that I'm working on where the medics will be going into the homes and doing some sorts of assessments, some sorts of treatments in the hopes to keep some people out of the hospital. It is, you can research it, you can Google it, look on it, it's a national program. However, it's kind of catapulted very quickly with coronavirus. So with limited bed capacity and limited staff capacity, there is a push to keep people who are not quite sick enough to be hospitalized in their homes and have daily visits by a paramedic and or nurse practitioner. And so that is what we are currently doing. We see on average about 3 to 5 patients a day, and we currently have today 10 enrolled in the program. We've had upwards of 20 to 25, but we see them on day 1, 3, and 5. I can go into it more if you want to know more about it. Just ask me questions after this, but that is what they are doing on top of their regular duties. And looking at the second page, our destinations for 911 calls have not changed significantly. We are still able to take patients mostly to where they need to go. They do get a daily briefing on the bed capacities at different locations, but for the most part, places are still accepting 911 calls.
Samantha, what's the non-applicable on the second page?
Those would be your treat no transports. Some of those are also, if we put the patient on a helicopter or a nurse, some of the nursing homes, things like that, there's not necessarily a destination code in the electronic health record for some of those places.
The state assigns an identifier to all the major hospitals, so there's no identifier assigned to nursing homes, private residences, stuff like that.
Said the ambulance personnel are going and making those visits, whatever that, is that on here?
Mm-hmm. That's between your,
Oh, in,
anyway.
okay, I didn't see it, okay.
Yep.
That's good.
It's been very well received. Some of you may or may not have met Nick Thomas. He's our lead person in that. He's an RN and a medic. He's about a year out from graduating as a nurse practitioner as well. And so this is kind of his passion. He wants to have a patient load, but he also enjoys the pre-hospital side of things and being involved in EMS. And so we're letting he and I wrote a business plan, and we're kind of growing this to see where it can go. But it's being, the nurse practitioner right now that's seeing patients in the home is Amanda Talamentes. And she also sees our patients in our nursing homes as well. And so it's very, very well received by the community. A lot of these patients that we're seeing right now live at the high rise, and they don't really have a lot of care needs, more it's social service type needs. How do they get their meals? If they're in quarantine, how do they get supplies? How do they get, if they don't have a driver's license or somebody to get things for them? I mean, some of the things that the medics have had to do is go get apple juice or go pick up toilet paper or coordinate pyramids to deliver some medication for them because they don't have the social service support or the family support that they would need.
And so that kind of fits in with me and building Meals on Wheels.
Yes.
That we've noticed that there's a pretty high concentration of new Meals on Wheels going to the high rise.
Yeah.
We thought it was just word of mouth, but I guess it's probably your.
So, yeah, so we work, the medics go in, they do an assessment, they have a very focused assessment, asking them, you know, if their activities of daily living are being met, and then they work with our hospital case managers to get services lined up in the homes where they can. What we are experiencing right now is a lot of these home care agencies, if someone is diagnosed with COVID or in quarantine because of COVID, they just stop their service of coming into the house to help them, and they don't notify anybody. They don't notify their primary care physician, they don't notify a next of kin. And, you know, these guys are going into the house on a 911 call and realizing that somebody hasn't checked on this person for 9 days. And so we recognized very quickly that there was a need there that we needed to meet from a community health standpoint. And so we're trying to work with some of those agencies to get things opened back up.
Are you reimbursed on this in some or is it just community service?
Right now, it's community service. Yeah, it takes a lot of the medics' time and a lot of our resources, but they have all stepped up. They are doing amazing. I mean, when you see those ambulances go by, they are your heroes in this community. So you guys need to recognize them, buy their meals, do whatever you want to do to recognize them, because they are not getting paid, and the hospital is underwriting a lot of that. Now, I am in the process of applying for a grant through CMS called Hospitals Without Walls. So Friday I worked all day on filling out the application for us to be able to administer care outside of the hospital walls. It is a COVID federal lift on Medicare stating that you can administer some care outside of your hospital walls and bill for that service, but it's a long process. So we just now filed the application and trying to go through that whole piece of it. Any other questions?
Also noticed in the paper that Easy Care is not taken, they've changed their operation.
So Easy Care was only seeing about 7% well patients. Most everybody that was going there was sick in some way. So the primary care doctors and the Easy Care nurse practitioners got together and decided it would be best to try to keep all well patients out of Easy Care. So the well patients are going to be transitioned into the clinic more. So let's say your granddaughter needs her vaccinations to go play sports or whatever. That will be absorbed in the clinic where there's more well visits, whereas taking the Easy Care clinic and making it essentially a respiratory, because we are, not with just COVID, but we are entering influenza season, pneumonia season, all of those types of illnesses that we need to keep out of the well space.
I would understand because like well patients, you cannot go to a clinic on the weekend. So if I have a bad UTI on Friday, I'd have to get an appointment on following Monday because I don't want to go to the emergency room.
Sure.
So I can't go to Easy Care
You
on
can
Saturday,
still
Sunday.
call, so Easy Care's kind of transitioned to taking appointments. So before Easy Care was a walk-in,
Right.
they really just want to see those sick patients, but we recognize the weekend is. So with us having a Marshall location and a Paris location, they want you to call and get an appointment. and then they'll structure the wells kind of together, and they may send you to Marshall, or they may send you, keep you at Paris or whatever the case may be. They'll ask for transportation needs and that type of stuff too, but
It's kind of confusing.
yeah, I get it, I do understand that, but, we're asking the community to be just as flexible as we're trying to be, because we're trying to, every day something's changing with not just COVID, but with healthcare in general, and how we're administering it, how our patients feel comfortable receiving it. Some people don't wanna come into the building, they wanna be at the curbside, some people wanna drive through, some people wanna see their doctor, some people wanna FaceTime their doctor. So we're trying to meet how everybody wants their healthcare delivered in the safest, most possible way, not just for the patient, but also for our staff, because we are not indisposable either. And if we wipe out half of our staffing, then that impacts our community where we can't care for you. What else? Any other questions?
Thank you guys so much. Appreciate it. We understand if you need to take off, but you're certainly welcome to stay. All right. Augie,
No, I'm good, thank you.
do you want to talk about the county board meetings / study sessions /
Oh, the dates. I'm sorry.
yeah, the dates.
Yeah. In your packet, you have proposed,
You got 3 sheets.
you got 3 sheets. Highway, study session, county board meeting dates. It's fairly similar in layout, pattern to what we've been doing over the last 10 years, at least. And I coordinated the calendars with the highway department. I don't see anything outstanding, but certainly take a look at it, and if you have any questions, let us know.
Yeah, I just wanted to make sure that you knew it was in your packets. I figured you would. And take a look at it. If you have any questions, we can deal with that on Wednesday, or call Augie and say, hey, you forgot about this, okay? Thank you, Augie. Nothing else?
No, I don't think so.
Okay. You don't have a semi-annual report this time?
I do have one. It didn't make it in because I was finishing up just at the end of Friday, and I apologize.
Well, maybe
I
you
thought
guys
it was
have it
in
and I
there.
couldn't find it.
It should be right after the sheriff's semi-annual report. Yep, that's it.
Oh, okay.
So it's in there.
All right, it is in here. I see it, yes. Okay, so those reports are presented to us, not actually to approve, but to accept that they've been filed with us. Both the sheriff and the county clerk do that twice a year, just for you new folks, just so you know what's going on. Okay, Dan,
And nothing.
any cat scratches?
Yeah, got me this morning.
Okay. Okay,
Other than that, everything's fine.
Bill? Carl, did you want to talk about a couple of things?
Yeah, one, this letter to the bank on the alleys, vacating the alleys. Is that all 3, on all 3 sides, or?
Yeah, that would be on the north side of the jail.
Yeah,
That would be on the east side of the jail.
right.
And then,
North side, that's already. South side.
wait a minute. There's no, I'm talking the north side.
Yeah, north and east.
Right, and then the
South's
south.
already been.
So, yeah, the south's already been, so I'm not sure why
Red
that's,
Morgan something.
yeah.
So, and it becomes our property?
It, what becomes ours is ours, behind the jail becomes ours, or, which would be the east of the jail.
And the north side
Right.
becomes the property of Edgar County.
Right. The big thing the bank wants to do is like where that big pole is.
Yeah,
I think we looked at that, but where that pole going north to where that bar or the liquor store used to be,
Right.
they want to eliminate that totally.
and
Okay?
they're gonna pay for.
Yes. In
removal.
fact, they are going to help us pay for our paving when it comes time,
Okay.
okay? But we put those provisos in there because it's not gonna be a cakewalk to get
Right.
all that through. They may have to have a public hearing. I don't know what the city is gonna want them to do.
Yeah.
And they're taking the lead on it. We're not in the lead. We didn't ask for it to be done. We're just trying to be cooperative with the bank. Would you say that's correct?
Yeah.
Okay,
Yeah.
that's fine. Anything else?
We had a meeting one day last week on union negotiations with the jailers and dispatchers. We met conference call, Zoom, whatever you want to call it, with our attorney. We got their proposal. We made our counter proposal. They've relayed it on to the union, and they're supposed to get together today,
This afternoon.
and maybe hear a response back from them, so.
Okay.
I think that's it.
The other thing is all signed, sealed, and delivered, and everything as far as increases are in line, and everybody's caught up to, you know, the sheriff's deputies and our normal, regular employees are all being charged the same amount for insurance for the first time, probably ever. So everything is, and so we're hoping to get the other issues resolved with the jailers and dispatchers just as soon as we can. We look forward to cooperating with them and see no reason why we won't, okay? Andy?
We had sewer problems here at the courthouse and then at the treasurer's office too, so they had trouble, we called Ted Lang here at the courthouse a week ago, over a week ago. He came in, he couldn't get through, he got so far through and couldn't get it broke loose, so then they called, Jason Gore came through and he had a longer snake thing, and he did get through and got it cleaned out here at the courthouse. But I would like to, and here and, basically at the treasurer's office, but here I'd like to get someone in with a camera, if at all possible. No one knows where the sewer goes out here. Like I said, Jason got it broke through, so it was, I mean, it was basically closed. You couldn't use any bathrooms, any water, or anything here while it was plugged up, because it was the main line. But then last week, there's a clean out right over here by where the new air conditioning units are, and the city came by with their jet truck, and they force water down, suck it out, push it in. They kind of cleaned out in and around it. We're probably gonna have them come back again and jet clear down on the outside. There's an old cast iron pipe on the outside, clear down to where that is in the ground, to put a new clean out on it, so that hopefully we won't have the problem that we had last time. At the treasurer's office, it got plugged up, and we ended up calling. Sycamore said they could get somebody in there to clean it out, and we got it cleaned out, and we ran a camera down through there. There's a few issues in there. That there's a couple drops that it's old cast pipe, and it's got some sharp edges and things on it, but it may be somewhere you may need to do that once a year. I don't know. We'll just have to see what happens.
It was suggested that we dig that up in nicer weather, and
Now, the
Over
city
it.
said they're gonna come in.
Right.
And do from the building out to the,
right,
and they, yeah.
right, okay.
And it needs to be done. There's something funny at the end. We got as far as we could with the camera, and there was something funny right at the end, so they said they'll come, Camper said he could come in and dig that up. And I'd like to thank the city for letting us use their equipment too. That's a pretty, nice piece of equipment to have in the area, for them to let us use that. So anyway, everything's running right now. One more thing, the VRF system, they're gonna replace two valves in it that they found, I guess they found it during that manufacture of those, some of those valves that they have identified and are taking it in other places, that they've had trouble with those valves, so they're gonna replace both the valves, switching valves, and hopefully that'll take care of.
I have a good question, Andy. Is there any way that when those units are not at least supplying some of our heating, when those are not calling for heat, that they would not still blow air,
You can, they can be, you can shut them off.
but not currently? I
Yeah,
think
I
they're
mean-
stuck currently.
I mean, if it's blowing cold air on, can you shut yours off, Augie? I thought he said you could shut the fan off if you wanted.
No.
No, you can't.
That's why I'm asking.
All right.
In this time period that we've had all these issues, they've locked us out of being able to control our units.
Okay.
My understanding from the meeting that occurred the other day was, once the issues are resolved, then we'll be able to handle our own
Okay.
thermostats.
We just need to make sure that we
Yeah,
get to that.
we're supposed to be able to do that, that's
Okay.
correct.
But is it blowing cold air on you anywhere?
Occasionally it does, yeah, it blows a little warm air, followed by some cold air, followed by some warm air, followed by cold air.
Okay. I guess I was under the impression.
See, that's why I think we need to make sure that, like on Thursday, we need it 10?
Yes,
10?
yeah.
Yeah.
Maybe a closeout thing. I'm hoping, I haven't seen Sycamore yet. I mean, they gave me an email last week that they identified that they need to replace those valves. I don't know when that'll occur, hopefully soon, but
Those are things we need to
Find
discuss
out.
on Thursday morning too.
Okay.
Anything else?
Nope.
Russ, sure you've got a lot to say.
Not at the moment.
Lisa,
No.
questions of other areas? They can be questions, not a report.
Edgar County Airport, do they meet? Is somebody gonna contact me? Do I need to contact somebody?
Well, I thought you didn't want to be on that committee,
I don't.
so you're not going to be. I don't have
Okay,
you
well,
on
it's
my
on that
list.
piece of paper I got.
Yeah, well,
That was
we just,
proposed.
that was just a
Okay,
proposed.
all right.
Yeah, no, I was not going to do that to you,
Thank you,
all right?
thank you.
But to answer your question, yes, and that's all handled through the airport manager. So if you ever do want to come out and just explore, I'll make sure you're aware of the meetings,
Yeah.
okay?
Okay.
That was sarcasm. Okay,
I have one question.
yes, please.
Workman's comp, are we with the same company now that we were with through Diamond Brothers?
Yes. And he bid it out, we didn't bid it out per se, but he checked around and got quotes, and they were still the best company to have. They raised us, I think, 11 grand, and the others were, I forget, it went from 60 to 70, and the other folks were around 100. Okay?
Well, I was just asking, I was talking to an employee the other day, and they had an injury, and it's been going on for some time, but they were scheduled for an MRI, and they had to go clear to Bloomington to get an MRI. And they said, I'm not going to Bloomington to get an MRI, and they said, well, you have to, because that's the only in-network place. And I didn't catch the end of the conversation when they were talking about it, or I just wasn't paying attention, but they were trying to reschedule it for somewhere else, and they hadn't heard back for a week or more.
It's still the same company.
Okay,
Is that something that your ladies would know about?
They're from this
Probably
area.
not, that's the first time we've ever heard of it since
I
we've
haven't
been
heard
using.
any, yeah,
We've been using IPRF forever. and
right, and they always send them to Carl,
She
so.
said that she had to go to Bloomington Normal to get an MRI.
I wonder if it has something to do with COVID.
Yeah, it could. I mean, it could be
I didn't ask the details, but.
Go ahead, Augie.
Well, Carl, I just thought of something. We had to notify Illinois Public Risk Fund that we were going to bid out the policy. And so in that, we had to provide a 90-day termination notice.
And I signed it
And
the
you
other
signed
way.
it. And in that, there were some issues that they, Illinois Public Risk Fund, would not come and do any kind of visits, training, meeting. They wanted, because they were on notice that we were gonna discontinue them. But then, so, could have been, we were caught in between that time period, but then when they were notified that we were gonna renew, then it's like everything got turned back on, so to speak.
Okay.
So it's possible that that fell in that time period, but I don't know that.
I'll do some follow-up with it.
Well, I will, I'll see about MRIs in general.
Yeah. Well, it's Linda. She was telling me about it,
Who?
my sister.
Oh, okay.
Okay.
Are you gonna take care of it then?
Yes, sir,
Augie?
I'm gonna take care of
And
it.
then if you have to, check with Oxford.
Yep.
He's in North or South Carolina, I think, for a day or two more, and then he'll be back. Okay. Committees to the board. I have a draft here that I'll give to Augie. I thought we'd talk about it for a few minutes. The Road and Bridge Fund and the Motor Fuel Tax Fund basically involve all 6 of you that aren't chairman. So basically, we've left the Road and Bridge as Patrick, Ellis, and Luddington, and the motor fuel tax as Bruner, Lawton, and Farnham. And that's pretty standard. Insurance, Andy's chairman, and we put Lawton and Ellis on that, because that's a good way to find out what's going on around, if that's amenable to everybody else. Animal shelter is Bruder, Luddington, and Lawton. You get to work with the boys. They'll get you cued in. Building and grounds, Patrick is still chairman, Farnham and Lawton. Budget would be Ellis, Farnham, and Voigt. Airport would be Voigt. Bruner's Public Health. 911 is Farnham. County offices would be Ellis. That seemed to make sense because you had some things that you thought could be done, and you have the skills, obviously, to do that. Drainage ditches, which it's very rare that we have anything, but I put Russ with that one. ESDA, or did I mention 911 would be Farnham, and then ESDA would be Voigt. I've kind of done that for the last few years. 708 and Chamber would be Ellis, and regional schools would be Luddington. So, does anybody who's turned off by any of that? It kind of spreads things out kind of fairly, but we'll get that typed up and sent out. We can still change it if we need to, otherwise we'll kind of go by this, and it gives exposure to everybody, you know, with certain key areas, and so you can get your feet wet if you're new, and if you're not new, it may be a few changes. Okay? Does that make sense? All right, let's see. Oh, letters, okay. Time and dates, file sheriff, file clerk. Okay, let's talk about Bellwether. We got proposals, which I sent out, I think, to all of you, both Bushu and Bellwether. Having read over and talked to the principals at each place, I would like to recommend that Bellwether be who we go with, at least at this point. They seem to understand, they keep calling, and, well, not keep calling, they're not pestering me, but they're very much looking forward to helping us with a few issues that we already have. Hit the ground running, I think, is $6,000, and they're gonna deal with a couple of big issues. They'll also be given the lawsuit to, and I'm gonna talk to the state's attorney about that here in a little while. And they'll also deal with some other personnel issues that we have. And then their retainer is $500 a month, which, and Augie can probably help me with this, but basically Bushu was, I explained it all out to them, and I'm not criticizing them, but they just kind of shotgunned it rather than being specific, and basically wanted us to fall back into the same contract we had with them a couple of years ago before we terminated it. I just felt like the personal touch was there with Bellwether that we need. And all those contracts, whether it was one or the other, could be terminated at any point. So I think it's 60 or 90 days. So it's not like we can't respond in a way, shape, or form that's beneficial to us. But we need to get started on some of these issues. So, comments?
Now, the Bellwether looked like they were more economical in the long run, definitely. And if you've worked with them before and had good working relationship with them.
I felt much more comfortable that they understood the issues hitting the ground, okay? I think that's the best way. Augie, you looked at it, did you have any?
No, I would agree with your assessment.
So the 6,000 one-time fee,
Right up front, yes.
Okay.
But they'll also tackle some of our bigger issues right
so
away.
if we want them again next year,
No, then,
Nope, it's just 500.
okay.
they're with us. In other words, let's just say, and he won't, but Augie has an issue that he's got a question of. He picks up the phone and calls them, and if he can't find the answer here, and they'll also review some of our policies to make sure over a period of time, and help us when we need it. And any department head or elected official can pick up the phone and ask for help or advice, and we'll have a monitoring system where we'll know what's going on as the board, since we're paying the bill. But I think that'll work out a lot better. We desperately need HR here,
Right.
okay? And we're a small county, and we just don't have the resources right now to do that. And they offer something and a lot of experience because they help a lot of other smaller counties, okay? So that's on the agenda. The Jet A fuel system is in there again. I think it makes sense. It's been reviewed. It's cancelable in 30 days. I think it can work, and it might lead to them using the airport a lot more, and maybe something else will develop out of that with this agreement. Can't promise that, but I definitely think it's a positive step. I don't know whether we get a fixed base operator out of it, but their footprint there may expand. And it benefits us and benefits them. So, Lisa, on the committee for the wind farms, I talked to John. He's cleared now, if you could email me a couple of dates that it makes sense for you, so that we could at least sit down and go over an outline of what we plan to do over the next few months, that would be very beneficial for everybody, I think, okay? And budget-wise, we're gonna be early in the month, so our meeting is the 9th. I didn't get a copy of the budget for the board. I will try to get one on Wednesday morning when they receipt it in as much as we can. We should have a safety tax deal. I think I told you, and it is true, that we have billed out all of our $260,800 in cures money, and that is in the pipeline to us now, and that will finish that up. We have asked for an additional 100,000. We should hear soon whether we'll get part or all of that. I doubt if we get all of it, but any part would help. Do you have any questions of me? Yes, sir.
Had a assistant call me on Saturday. They had a friend flying in the airport for a funeral.
Yes,
They
sir.
want to know the procedure. I couldn't really explain how they do it. Is somebody out there on Saturday?
No, it is a card machine. It would be like going to a gas station where you just go in, push your card in, there's an explanation, and you can get fuel, whether it's Jet A or avgas. And nobody has to do it. It's just kind of like going to a self-serve gas station.
I kind of told them we had that, but they wanted the courtesy car.
Okay, then you go in the front door, and there's a sign there,
Okay.
okay? And they would call, and either Tom or
They called, was it Dave?
Dave.
Maintenance, yeah, that's who they got hold of. Everything worked out okay, but I told them to call Tom, and they said, well, we called, got a hold of Dave. So
Well, it
we'll
switches
take
off,
care of
yeah,
it.
right.
Dave, he still works on Saturdays.
Okay.
Okay.
Yeah.
He's not there, well, I'm not sure how many hours, but he's there most of the day.
Yeah,
They got a hold of him, and
Well,
everything's
that's
taken care of, so.
all right. Well, even after hours, there's a phone in there and so forth, if there's issues.
Yeah, if they have something like that, maybe call ahead,
Right.
you know, and have arrangements made, you know, if he does need a,
I think everything worked out fine, so.
I'm glad you brought it up.
Yeah.
Yeah. We're trying to be more convenient. Tom says the gas or avgas and Jet A have picked
I
up a
told them I had
lot.
a credit card where they could
Yeah,
put in the
there's,
gas.
so,
He said they picked up a lot?
of course, now it's on, you know, when you're making flight plans, it shows us on the map now as you can refuel.
Yeah.
And a lot of folks, I think, were turned off by the fact that, well, can we get somebody, can we not get, you know,
Right.
so
So you just go
we're just
there.
more convenient as time goes,
Yeah.
okay?
It's been many years.
We are gonna try to get some tours set up, especially like the jail. And we can do the airport too, and have Tom kind of show you around to make sure what's available, whether you're new or old, okay? So we'll try to do that.
There's pancakes in the hangar.
Oh, yeah, yeah.
That's the last time I've been.
Oh, that's been a few years back. Gary, do you have any questions?
What's the status of the effort between the sheriff's department and the police department to create the joint detective operation?
We are currently looking for another deputy so that we can get into a position where we can assign one of our current deputies to that. I don't want to speak for the city, but I think they're having some issues, not with doing that, but just with personnel. I mean, just like we did, we finally got a full deck of deputies now. And now we need to find that other one, and quite frankly, it's not easy to find somebody that's well qualified to be a deputy anymore. I mean, it's tougher and tougher. For example, in the contract with the deputies, in the past, and I can talk about it because it's all approved and everything else, we've restricted them to find people in Edgar County. Now they can look in counties that touch Edgar so that they can look and advertise for jobs in Douglas or Vermillion, or we even touch Champaign County a little bit into the south. Now, we can't go into Indiana because of the way the laws are, but we can touch and hire people out of the other counties now. So that gives us another 6 counties that we could look in and hire people. And we're actively trying to do that. Does that answer your question?
I figured that's where it was. Is there a time frame for when?
ASAP.
Okay.
It just as when everybody's successful in filling out their departments, and we're filled out, except we need an extra person now to be that. And we did pass a budget that includes that. Okay. Carl, did I get that right? Okay. Is there any need for a closed session today? I'm sure the state's attorney will probably want to talk to us here in the next meeting or so to review anything that we've got pending. So I don't know of anything else right now. Andy, were you gonna say something? I guess I'd entertain a motion to adjourn then. Andy moves, Phil seconds. All those in favor signify by saying aye. Opposed, nay. We're adjourned.